Good day, everyone, and welcome back to another episode of Public Health Career Conversations. I'm very pleased to have with me today Dr. Patrick Ngassa Piotie. Patrick is the chairperson of the Diabetes Alliance in South Africa and is also an extraordinary lecturer and project manager at the University of Pretoria. So thank you so much, Patrick, for joining us today.
Thank you, Atia, for having me. I think it's a great initiative that you're having there.
Thank you. I'm really hoping that all of you fine people who have spent time with me will provide the viewers out there with some insights into public health as a career and what it may mean for different people as they progress. So having said that, my first question to you is really about why public health. Everyone has different reasons for why we decided to pursue public health as a career. So maybe take me through that. What piqued your interest, and then how did you go about deciding that you wanted to transition from clinical medicine into public health?
Oh, thank you, Atia. Obviously, that's a question that I'm sure, as you know, we have to answer a lot of times. Yeah, so I qualified with my medical degree. I studied in another country, and then I went back home in Cameroon. And I started practicing in a small private clinic. I used to see about maximum 10 patients a day, something like that, quite chilled. And as I was sitting there, I started being confronted with the challenges of practicing medicine in Cameroon, especially when it comes to the failures of our health system in Cameroon. In Cameroon, it's quite disorganized. Yes, we have a primary healthcare system, but it's a lot about out-of-pocket expenses. It's a lot about impact of corruptions. For example, to access the facility itself, the health facility, the patient already has to pay a fee at the gate. You pay something at the gate, and then sometimes you even have people waiting for you. When you come, they ask you if you want to see a doctor and stuff like that, and they grab you and they bring you to a specific doctor that they are working with inside. So there's quite a network of corruption and all that. But obviously, I was in the private. I wasn't really impacted by that aspect. But when you receive then a patient and then you place a diagnosis, you give a prescription, very often the patient, if they are not on medical aid, which is in Cameroon, probably maybe 10%, 20% of the population will be having access to medical aid, maybe even less. They will tell you sometimes that they don't have money to go and buy the drugs. So you've done all that work as a doctor, you give a diagnosis, you give the thing, but they cannot have access to the treatment. So what has been the impact of your work at the end of the day? So realizing that and seeing the whole pictures, we have a big market of counterfeit drugs in Cameroon, medicine being sold on the street, anybody opening a small spaza shop, but for medications, and then being called doctors, walking around with white coats. It's crazy. It's crazy. So looking at all that, I felt strongly that the only way to have a real impact would be to go into public health, because there's so much things that needs to change. There's so much more that we need to do to actually benefit the patients when you are in the system, as I said, that is heavily out-of-pocket based, and people are held out from ransom. Sometimes you have an accident in the street, they collect you, they bring you to the hospital. If the family is not there to start paying money, nothing will be done. I have a friend who lost a parent because of that. After an accident in the street, he didn't receive medical care and he died because nobody was there to pay on the spot. So yeah, I think it's that drives my desire to go into public health. The situation in Cameroon, the quality or the lack thereof of the health systems, and obviously the burden that it brings on the families and the people, the patient and all that, the communities.
Thank you, Patrick. That was, that is not unlike many of public health practitioners' journeys. Seeing on the ground as we work in the services, the issues really makes us want to think about the higher or the bigger system level implications. I just have, before I get into sort of what was your journey in public health, I just actually want to ask you, because you said you studied in another country. What was, did you do public health in undergrad there? Was there any public health training, or how did you know then that public health was something that was a possibility? Because not all undergrad training really focuses on public health.
Yeah, no, thanks for that, Atia. So I studied in Mali. I did my medicine in Mali. And yes, in first and second year, we had a small, I guess you can call it a small module in public health. So for example, I remember still the Declaration of Alma Ata. We had to memorize it in school. I remember a bit of epidemiology. We used to do a really basic epidemiology. So yeah, that's where the first contact with public health happens. And also, as we obviously are in the school and as we are progressing, we heard about options going forward. Obviously, coming from Cameroon, one of the big goals is to work for WHO. So when you think about that, they will tell you it's about public health. And I remember specifically there was a time there was in the Faculty of Health Science there was a training of epidemiologists. I think it was maybe a first epidemiologist training facilitated by WHO or something like that. So there were a lot of doctors who came from different parts of the continent, some from Cameroon, Togo, Benin, and stuff like that. And yeah, we saw them and we like, oh, that looks like they look fine. They look like they're doing something good. So those were the exposures that I had with public health going up or going through my medical curriculum.
Ah, okay, that's very, very interesting. And it's good to know that, there was sort of practical training where you saw people actually doing public health. And so it wasn't just theory around public health, it was really understanding, because I think a lot of people don't really understand what public health practitioners do, because it's not shown. In med school, we watch people do surgery and we watch them, do all of the interventions, but we don't really watch someone do, sort of public health type intervention.
No, that's true. That's very true.
Very interesting. So then once you decided to pursue public health, what is it then that you did? Did you go and study further? Where did you end up working? What has your career looked like since?
Yeah, so the decision was the easiest part. Getting started was the most challenging part. So I'm in Cameroon. I already had a brother staying here in South Africa. And as I said, the ideal career is that glamorized international career, working with WHO and all that. So I'm like, okay, I already speak French. So to increase my chance of reaching that dream or that goal, I need to study in English so that I can be bilingual and have access to those kind of training. So my brother being here, we knew of the quality of the universities in South Africa. So my brother said, no, apply at University of Pretoria. I'm sure they will take you. So I applied for a master in public health. And then I did the trip. I came here, I started doing some English classes, waiting for the outcome of my application. Unfortunately, it didn't go as planned. The University of Pretoria initially rejected my application, and I found myself in South Africa not knowing what to do. And it started really a long journey. I'm not going to get into too much details, but eventually, that was in 2007, 2008. So I went back to the University of Pretoria website. Obviously, you can imagine I'm from a French-speaking country, a Francophone system. We don't speak bachelor, we don't speak honors, we don't speak masters. And so I'm trying to navigate what are these qualifications are, what is it? So the whole understanding of the system was already a challenge. But at least I saw that there were some diplomas that looked like they were below the master level. So my approach was, if they rejected me for the master, is because maybe there is a lot of applications and they don't really see anything concrete in my CV. I wasn't working in public health. I barely finished medicine, and and all that. So I'm like, let me find a way to get into the system, and then I will get probably access to the master at some point. So I applied for a diploma and it was successful. I first did a diploma in tropical health medicine, and then I do the diploma in public health medicine. After that, then when I applied for the master in public health, eventually they took me at UP. Obviously, I didn't know about VITS, I didn't know about UCT and all that, so I was really focusing on UP, especially because my brother was here and I was living with him. So yeah, UP took me for the MPH, and I was then going through the 2-year, 3-year journey with the MPH, doing the module. Quite exciting, a lot of new things. And with hindsight, I realized that doing those diplomas helped me actually to settle better rather than just to be dropped into the MPH, having to adapt with the language, having to understand all these things people are talking about and struggling with my own English. It would have been quite of a challenge. So yeah, I finished my diplomas and I started my MPH, and I enjoyed it. Interaction with the other classmates. At that point, there was a lot of people doing the public health medicine the registrars that were around. It was quite interesting to see what their journeys were. There were other people like from Nigeria, from Congo, also trying to do to get into public health. So it was really a nice environment, and obviously at UP the lecturers are quite interesting. But now I'm almost going towards the end of my MPH, and I realized that I've accumulated a few qualifications, but in terms of experience, I'm still at the same level. What am I gonna have? My chances of working in the future obviously are compromised if I remain at that level. People might not be able to employ me. So my goal doing the master was that I need to find something at all costs to get one foot through the door. And thankfully, there at UP, they used to send some opportunities for students to consider and stuff like that. And I used to apply, but obviously being a foreigner on a student permit, it was always a challenge. During the interviews, they will ask you if you have a work permit. And if you don't, it was almost the end of the journey. Or even if the interview was successful, 2 days later, you receive an email. Oh, by the way, do you have a work permit? If you say no, it's most of the time the end of the road. But now there was this one opportunity by the United Nations UNODC, the United Office on Drug and Commerce or something like that. UNODC is the abbreviation. They were looking for interns. So they are looking for interns, meaning you don't need to have a work permit. They will take you regardless. And they don't pay you. So there were no payment at all. As you might know, the UN internship are not remunerated. So I was like, that could be a good opportunity. And I applied and I went for the interview, and they took me. I ended up spending 9 months with them as I was completing my master. And I think that was really the game changer for me, because after the 9 months, I could eventually apply for a work permit that I received. And then I used that, the 9-month experience plus my qualification. I sent my CV out there, and I had my first opportunity for an interview at Broadreach Healthcare. I went in Joburg, I had the interview, and it was successful. So my first public health job was at Broadreach Healthcare as a research and evaluation officer, something like that. Obviously, first opportunity in the workplace, everything was first for me. But it was also, again, another good experience, meeting other people who had done the journey, PhD level and other master level and all that, and having Dr. Sophie Pasco as my boss there. It was quite a good first experience. After that, the company was restructuring at some point, so we were on the process of retrenchment. We were informed, so I started applying again, and I then had my second opportunity at VITS RHI, the VITS Reproductive Health and HIV Institute. And yeah, I stayed with them for, was it 3 years, 2 years? Anyway, then a few things happened there and we had to part ways. We had to part ways. So I'm sitting at home, I'm considering my future and all that. I maintain good relationship with my supervisor for my master, Prof. Ansel. He supervised my master research. And I always hit on him, Prof, I still want to do a PhD. Is there any opportunity and stuff like that? And yeah, as I was sitting at home in 2017, 2018, he informed me about an opportunity for a PhD. I came for the interview with Prof. Heder and Prof. Ansel. It was when they were looking for a student to look at transition from oral drugs to insulin in the primary care level in the primary care system in South Africa. So yeah, they accepted me for that opportunity, and I started a PhD in 2018. As we were doing the first year of the PhD, as we are writing the protocol and doing the ethics application and all that, a private company approached us, approached Prof. Heder. They had some funds that they wanted to put into research in diabetes, and they had a prior relationship with Prof. So my PhD basically was rewritten into a full 5-year project, and eventually I became the project manager. So that's I ended up having. I always say that I think I, I had the best PhD journey ever because my work was my PhD and my PhD was my work. So I didn't have to look for people to collect data for me. I didn't have to stress about anything, and I had a salary. So it was really a perfect setup. So yeah, that's also how I got introduced to diabetes. And that's also how we've working with Prof doing this primary care oriented project, having to make connection with the people at the Department of Health, the people at the district and the City of Swade and all those people. So I used to go to the meetings to represent Prof, trying to make connections and all that. And through those meetings, I once met someone by the name of Bridget McNulty, and it's through Bridget that I got introduced to diabetes advocacy. And it also started a new journey as a diabetes advocate. So yeah, that's basically how I found myself where I am today.
Ah, that's great. So there's a few things that you said that are really interesting. And I think first I want to just say that thank you for sharing about not getting into the MPH, because I think I also didn't get my first application to be a public health medicine registrar. And I think given the amount of interest in public health that there is currently versus the amount of opportunity to train in public health, I don't want people to be disheartened if they don't get in the first time. And I really like what you said about going and doing the short courses, and not only because I think you had to grapple with conversion into English, but also there's public health language. It's a very different language that you're not learning in medical school. There's different terminology and frameworks and that. So there's a really good, I think, reflection for anyone that is watching and may feel disheartened because at first attempt they don't get into a program. And so yeah, just speaking about those benefits of doing the diploma was really, really great. And then also your reflection around translating your knowledge into skills. And I think that is what a lot of people, especially medical doctors, struggle with, is if you're working in a clinical setting, but you're studying public health, sometimes it's very difficult to think about how to translate that. And I'm glad you got the internship. I do think we need a lot more internships in public health, and hopefully paid one, not unpaid internships, but at least some sort of remuneration, because it is difficult for people to learn, and it becomes a bit of a sort of chicken and egg situation where people want skills, but you can't get skills until you are actually doing the work. And so we really need to work towards, UCT does something called a practicum with their students, where it's an elective where you can go do a practical project, which gives you a portfolio of evidence then at the end. And I think we need to do some more of that for, so it's, again, I like that reflection, because people may come out of MPH and think, now what? But hopefully there are, internships or research assistance on projects, something to get your foot in the door. I think that is the lesson there, is that you need to find something to get your foot in the door. And then the final thing that, I think is also really great reflection is around the PhD. And PhDs are quite an undertaking. I'm still contemplating mine. But yeah, that's also something, and a piece of advice someone gave to me is, as you say, you were very lucky that your work was your PhD and you're not doing it after hours trying to, so I think that also is a good piece of advice for someone who is thinking around a PhD, is that find a way to craft it into the work that you already are doing. So you've already given me like 3 really great pieces of advice for anyone that is watching, but I'm going to ask you again, in case there's something that, that you think of specifically would be helpful. If you were looking back at yourself, when you were sitting in Cameroon and you made that decision to pursue public health, and if there's someone who is sitting in a similar position, who is thinking around pursuing public health and not sure, what next steps, or whether they should take the plunge out of clinical medicine, or even not even clinical medicine, if they should take the plunge out of whatever job it is that they're doing now, what are some of the advice that you think is useful for somebody who is at that point in their career?
Oh, thank you, Atia. Yeah, it's obviously, as I said, I spent a lot of time at the School of Public Health there, so I could see a lot of profiles of people coming. I think the difference with me, obviously, I already severed myself from a clinical career by leaving my country and coming to South Africa. And as a foreigner again, not have been registered at the HPCSA, going back to practicing would have been a different journey to practice in South Africa. And as I said, my passion wasn't there anymore. So there is a doctor from a Nigerian from Nigeria who is practicing here. Sometimes I go to him when I need some clinical stuff. He has a MPH on his wall. He graduated long time ago. I think maybe 5 years before I even start. But he's still in the same position as a practicing general practitioner, because he never took that plunge. I think one thing that is challenging when you, for example, the difference with you guys who do the registrar posts, then you guys get those rotations and stuff like that. Obviously, it starts building the portfolio of evidence that you mentioned. For somebody who is practicing medicine, who has that desire to do public health and do the courses on the side as he's doing his clinical, obviously receiving his salary and all that, it will always be a challenge, because unless we know, for example, the HIV organizations were looking for doctors to assist in the HIV program or TB program or stuff like that, if it's not those kind of positions, it becomes very difficult, because sometimes you have to maybe take a lesser salary, or sometimes you'll have to really put yourself in an environment that you are not used to at all. So it becomes very challenging for them. And I've seen a lot of them who, after even completing the MPH, they remained in their comfort zone and they never transitioned. So the question is really about the one challenge is about the transition. Are you really passionate enough for you to be ready to make the sacrifices that you might have to make to follow that public health career? Another thing that I've noticed is those who were already sitting maybe at Department of Health or in whatever organization doing some sort of public health work already, and then they come into doing the qualifications. Maybe they already had an M&E background. Obviously, we know a lot of people started doing M&E without having done MPH. A lot of people start doing project management or whatever without having done the courses themselves. And there's this tendency of, because they were doing M&E before, even after they complete the curriculum, the opportunities that come to them are always still M&E. So it's also it's also up to them, or to really want to break out of it. For example, if you want to move into more project management, into more policy work, or like to really grow, because I believe M&E at some point, if you become an M&E director or something, that's the end of it. You're not gonna, with M&E, you feed information into to something to achieve something else. So there's always that challenge where the fact that they came in with already a career make them to kind of be confined into that same path. And it's also sometimes a challenge. Otherwise, I think it's all about passion. If you are passionate initially, you are really convinced that this is what you want to do. I'm glad that you are putting these materials out there. You need to, about getting information. What is actually public health? You need to break it down for yourself. What they said, is it that I'm excited about public health? Like I spoke to somebody who wants to do public health. I said, why do you want to do public health? No, I like community. I like to talk to people in the community. I like it when people take the medication. But you don't need to do public health to do that. You can go and do a community activist or something. So to understand a certain degree of, okay, what is actually public health that I want to do, and are those things that I will have to do to get to what I want to do, and to know that there's not a common journey. I'm sure one of the things that will come out of this series that you are running is that everybody has a very distinct journey. That's also the beauty about public health. You are starting something, an umbrella, you never know where you're gonna end. And anytime, like I said in my case, now I'm more into diabetes advocacy. Who knows? Maybe in the future, I might even move a bit away from the university to focus more on advocacy, because there's a big gap in that aspect in the country. So it's really dynamic. It's really unpredictable. And we can just give the advices. Yes, you need to get the training. You need to get the training with whichever organization or university you can get admitted to is important. I don't really believe in the online, I don't know about you, how you feel about that, but those online MPH that are flourishing out there, I don't really know about that. I think it's important to have that contact with the colleagues, the contact with the lecturers, and at the same time, it's also build your networking, because who knows, maybe one of the lecturers can facilitate a job opportunity for you in the future. And yeah, getting to know things and not being shy to start from zero, because that's also what is it about public health. When you are in an interview, they will ask you, or the interviewer is interested, but what can you do? Yes, you're a medical doctor, but what can you do when it comes to public health? Can you do some M&E? Can you do some research? Can you do some project management and stuff like that? And these are the key skills, to be honest, that we don't really emphasize a lot when we are doing public health. But a lot of jobs are looking for project managers, are looking for M&Es and stuff like that, M&E specialists. So these are the kind of skills one need to consider. Obviously, we sometimes don't take seriously the fact that when we do our master research, we need to publish. Maybe it's also something you need to emphasize. Any opportunity to either go to present at a conference or to put a publication out there need to be taken seriously. I've seen a lot of students, after they finish the dissertation, they drag their feet to turn it into a publication. There's somebody that I'm trying to motivate to really put her to write an article at the moment. It's something that is important. We might not see the value now, but when you go for those public health jobs, these are the things that they take. Have you published? What are your writing skills? What are your reporting skills? And all those kind of things, communication skills. So these are the things that one needs to do. So passion, get as much information as you can, but be ready also to make sacrifices if the moment comes, if the times come.
Thank you. I have to tell you, when you were, so I'm making notes as you're talking so that I can pick up on your points. I wrote down passion. So when you said passion, I was like, good, okay. But I agree. I think there's two sort of uses for public health. There's people who are passionate, and those are the ones, as you say, you need to sort of, commit, be ready to sort of, take a step back maybe in your career. Not to say that your medical training or whatever undergrad training you had won't be useful later. You will find a way of bringing those skills together, but you may need to from a monetary perspective or from a sort of time in career perspective, just take a pause or take a step back. So if you really are passionate, that is something that you will need to consider. But then there is, to the point around your doctor who's got the MPH on his wall, it's not a loss for anyone. And I think, as you were talking about those online masters, I agree. I mean, that you have even less opportunity to engage with the content. A master's program where you are in class, you talk to, and one of the values of a master's program is that a master's in public health has people from across different fields. So you don't even have to be in the health field to pursue a master's in public health. So you get all of this really rich discussion. And so you may not get that from an online degree. But if you are someone who has a peripheral interest in public health and you see it as a way to augment what you are doing now, then yes, those things are perfect for you, because you can just go and read up about, the skills, and you can have that knowledge and you can figure out what to do with it. But it's not going to translate into practical skill if you want to go into public health. And so that is, I think, a really good reflection, again, from you around, what that nuance is, and being clear about what you want to do, what part of public health you want to be in, or how steeped in public health you want to be, and then making decisions along that. So thank you for that. I think that was a really good, really great reflection. So Patrick, I have covered my questions. I don't know if you have any last parting words that you want to add before we close.
No, just to really congratulate you for this opportunity. I remember I once wrote a blog. I have a website that I started a long time ago. I wrote a blog about what is public health. And the question I usually used to get, I have an uncle who was quite disappointed when I said I was going to public health. He wanted me to do neurosurgery or something like that. But yeah, so there's always that question that comes, what is public health? And I'm glad that this platform will not only inform the public, but also people like who are considering it as a career, or people who are already in there who need inspiration on how to move around or how to move from a position where they found already themselves bored, on how to get out there. I think it's about a lot of adventure. You need to be ready to take the adventure. And also, as a parting point, we need to understand the skills we have. And I think it's something that I'm learning from people like you and others. You mentioned when you did your medical degree, you acquired skills. You think it's just sitting in front of a patient and just finding a diagnosis and just being a good clinician, but you have acquired a lot of skills: communication, listening, and there's computer there involved. We need to understand the kind of skills we have, so that when you are sitting in that interview, you can convince the person that it's not just what you see. I'm a medical doctor. No, there's more to it. You need to be able to tell a story, and in fact, when you want to get into a public health career. So no, really, I'm glad that you're really starting this, and you've been running this project, and I'm thank you. I thank you for the opportunity to be part of it.
Thank you so much, Patrick. That was a really great interview. Thank you for supporting it, and as you say, I do hope it provides value to whoever is out there watching it, so that they have, as you say, public health sometimes is a bit of a mystery to many people, and so this is hopefully unveiling some of what public health is, some of the many people from different backgrounds with different skills, and as you say, such varied journeys, and helping people to just understand that you can find your path in there. It may not look the same like anyone else's, but there definitely is a space for all different types and careers and backgrounds within public health. So thank you so much for sharing yours. I'm sure it will be very inspirational to anyone, especially clinicians sitting out somewhere when thinking, what am I doing? And is there a way I can do this better? So thank you. I really appreciate you taking the time to be with us today.
Thank you, Atia.